I am Yrick and I'm pleased to present to you my research study entitled Drivers of Resilience of Private Hospitals in Region 10, 11, and 12, Philippines. The content of this presentation includes a simplified introduction and background of the study, the conceptual framework used, the methodology, the results and discussion, and the recommendations to the stakeholders. Hospitals exist as a significant part of human needs. They play a significant role in diagnosis and treatment of illnesses and directly affects human life and well-being. According to the World Health Organization, the entire hospital system is a dual system. It is composed of public and private sectors. The private sector is a market-driven sector composed of for-profit and non-profit providers. Like any organizations, hospitals are likely to encounter crises and disasters that may have significant impact or may cease them from functioning. Hospitals have experienced significant crises and disasters over the past years. In the Philippines, natural and man-made disasters have been experienced and affected the healthcare system, including hospitals. In Mindanao, which is also immensely prone to natural disasters such as typhoons, floods, landslides, and earthquakes, and the armed conflicts and terrorism happening in some provinces greatly affect even hospitals. When disasters and crises occur, organizations such as hospitals must have the ability to respond and recover effectively to ensure that essential services are made available to the communities which are affected. Expectations are high for hospitals to play an important role in reducing injuries and deaths, sustain a safe environment for medical use, and sufficiently address the needs of the disaster stricken and crisis affected population. The concept of resilience is viewed as organizations must be adaptive and highly reliable, which transcends to all stakeholders, especially their employees. Zong et al. Affirm that hospitals must be the resilient organization during disasters. They should continue providing essential services and contribute to the well-being and safety of the community. Braun et al. Emphasized that hospital resilience is essential for it provides lifeline services during a crisis in the community. Thus, developing the resilience of hospitals will minimize the impact of disasters and crises by ensuring that they plan and are better prepared in terms of resources and can respond to the needs, especially on the delivery of healthcare services. Hence, this study on the importance of the different factors influencing the resilience of private hospitals in Region 10, the Northern Mindanao region, Region 11, the Davao region, and Region 12, the Soxargen region was conducted. This study used this conceptual framework. The independent variables that can predict the resilience of private hospitals are group culture, planning and preparedness, resource availability, partnership, information management, and technology adoption. The dependent variable is the resilience of private hospitals. The ownership structure and the DOH level of private hospitals are the moderating variables that will determine the strength of how it affects the relationship of the different factors and the resilience of private hospitals. This study is a quantitative research which examined the factors influencing the resilience of private hospitals. This study is descriptive correlational, which describes the profile of private hospitals in terms of ownership structure and DOH level, and the statistical relationship of the factors to the resilience of private hospitals was determined. The respondents of this study were from the private hospitals in regions 10, 11, and 12. The list was based on the official list from the DOH National Health Facility Registry. Three respondents from each hospital who were from the top and middle level managers answered the survey questionnaire. This study was officially endorsed by the DOH regional offices 10, 11, and 12 and the Private Hospital Association of the Philippines, or the PHAPI. A self-made survey questionnaire was constructed for this research study. Due to the minimum health protocols, this research was conducted through an online survey using Google Form. Survey through mail was also done. The statistical treatments used were descriptive statistics, measures of central tendencies, and multiple regression analysis. Stepwise method was utilized in exploring the relationship between the independent and the dependent variables. In analyzing the moderating effect of the profile of the private hospitals to its resilience, hierarchical multiple regression analysis was applied. The assumptions of regression analysis were analyzed before continuing the conduct of the analysis and interpretation. With 383 total respondents, the results revealed that majority of private hospitals in regions 10, 11, and 12 are owned by corporations, mostly having DOH level service capability. Private hospitals have a very high degree of group culture practices among its employees and extent of partnership with its stakeholders. They have a high extent of planning and preparedness practices, information management practices, and willingness for technology adoption. They also have a high level of resource availability. Overall, the private hospitals in regions 10, 11, and 12 have a high level of resilience. Ultimately, the statistical results showed that the factors information management, resource availability, and group culture significantly predict the resilience of private hospitals, where information management has the strongest contribution in explaining hospital resilience. Hence, a regression model of hospital resilience was developed. Moreover, the moderating effect of ownership structure and DOH level on the significant factors proved to have no influence on the resilience of private hospitals. The results of this study, specifically on the different practices of group culture, planning and preparedness, resource availability, partnership, information management, and technology adoption, can be used by the different private hospitals to be able to increase their level of resilience. As to the results of the level of hospital resilience, such information can be used in understanding the current stance of private hospitals in terms of their resilience. It can contribute to improving resilience practices because it can allow hospitals to identify their resilience score and underlying strengths and weaknesses. Specific management and operational strategies can be developed and employed to strengthen the overall resilience of hospitals and to be able to successfully withstand future disasters or crises. The outcomes of the study, specifically on the factors information management, resource availability, and group culture, found to have significantly predict the resilience of private hospitals, could help private hospitals to calibrate their strategic plans in areas where they have weaknesses. Changes and investments to new strategies can be materialized. The results of the study can be used by the different private hospitals, its owners and managers, to be able to increase their level of resilience. The, out- the recommendations includes investment in information management technologies, comprehensive use of social media as an information tool, creation of human resources attraction and retention plans, establishing sound financial plans, conduct trainings for inclusions and culture of safety, and simulate safety drills, investment in international accreditations, networking with government and private hospital institutions, investments in hospital related technologies, investment in substitute equipment, energy and supply resources, and investment in robust hospital infrastructure such as evacuation sites. The outcomes of the study can be used by the government, such as the Department of Health, the local government units, and other related agencies involved in regulating and coordinating with private hospitals to create new policies and enhance existing policies. Government support, such as effective information sharing, trainings, resource allocations, financial aid, tax incentives, and capability building can be designed to help private hospitals. Lastly, this study can be used by future researchers by using other indicators on the level of hospital resilience. New moderating variables that may affect the relationship between independent and dependent variables can be used. Same study can be conducted to other regions of the Philippines or with the government hospitals. This ends my presentation. Thank you very much.